I'm Dr. Richard Seeman. I'm a specialist in rehabilitation, and ABI Rehabilitation is the group that I work for. It was founded by a chap called Max Cavett, used to be known as Cavett ABI. So our purpose really is to provide rehabilitation to people with brain injury, and it's primarily to people with traumatic brain injury, so that's after accidents, we also do some work with people who've had strokes as well. And we have two centres, that's one in Auckland and the other one in Wellington. Probably what I need to talk about is a little bit about the brain as what it is, and then a little bit about brain injury. You've already heard from Tamati, and I mean, obviously the major effects of that, but I want to sort of put a structure around that, and then the types of things that we might do for people who've had brain injury, and here I'm really talking about traumatic brain injury. Okay, so one thing I want to say, here in Waikato there's been a very big study done in 2013 looking at traumatic brain injury in the whole of the community, and it's known as the BIOS study. And with that we know that there are many people in Waikato, and we generalise that to the whole of Aotearoa, who've had brain injuries. We know that about 1% of people in a year will have a brain injury. So it's a common condition. It's a very common condition. Now, clearly most of those people are with mild brain injury, what we know as concussion. You know, there's a lot of talk about it, particularly in the sports world, isn't there? So the rugby players and what have you. But to me, that is a major statistic. It means that many of us will suffer brain injuries in the course of our lives. And for some people, even this concept of a mild brain injury is not so mild, you know, that it actually has lasting effects. So there is a small percentage of people, and part of the work that I do is in what's called the concussion service in Auckland, and so we're also dealing with people who have effects of a mild injury, so-called mild injury, that goes on for many months afterwards. So let's just talk about the brain a little bit, and I'm sure that most of you do have some basic idea of what the brain is. Obviously it's a very, very significant part of our body. It's the area that controls our whole body and who we are and how we think. Now the brain is divided up into various areas, and to a certain extent you can say one particular area, you know, there's a particular thing that goes on in that area, a particular function, if you like. And so, you know, for instance, speech centres in the brain, pretty much in everybody on the left side of the brain, in particular parts of the brain, part of it which receives the speech, part of which is generating speech, that sort of thing. So when we look at a brain also, there's two, I guess, major components to it. One is what we call the grey matter. You know, when you talk about the grey matter, that's really the thinking part of the brain, the bit that makes all the commands for the body to move, the speech, all that sort of thing. And then there's the white matter, and that's the inner part of the brain. Okay, and that part of the brain is what connects the parts of the grey matter together. Those are all the pathways, the tracts, the communication pathways that travel through the brain and then down through the spinal cord into the body. So with certain types of brain injury, you can predict, I guess, what sort of problem somebody might have. If you look at a scan, you can say this, you know, this particular area of the brain is affected by some bleeding. You know, you might have some particular problem, you know, maybe a movement problem or a speech problem or something like that, or a visual problem. But for many people with a traumatic brain injury, it's what's called a diffuse brain injury. So it's affecting all of the function of the brain to a certain extent. Some parts to a very small extent, but some other parts to a major extent. And so we talk about a concept, diffuse axonal injury, which is where the whole brain gets shaken up. And sometimes you see little areas of bleeding within the brain throughout the whole of the brain. And that's perhaps the most common situation. So when we think about the effects of that, so I think we can talk about, so that it's easier to think about if you think about how a person is affected, but you can divide it up with the concept of the whare tapawha. And I think, I may be wrong about this, I think it's Mason Jury's concept of the whare tapawha that you may be familiar with. So dividing up the whole function of a person into various areas. And so we've got the body, the tinana. Tamati's talked about his problems with his walking, with speech, all those sorts of things. Those are what I call the bodily things that can happen after a brain injury. There's the wairua is the second part of the whare tapawha, so that's the spirit, if you like. And so that's really about things like your mood, your ability to manage stress, your ability to cope with situations that make you anxious. So it's about those sorts of psychological types of issues maybe that people quite commonly suffer after a brain injury. It's an under-recognised part of the brain injury, the changes that a person experiences in their mood, the irritability, the depression, the anxiety, those sorts of things. The third part of the whare tapawha is hinanaro, so that's things like memory, your ability to think back on things, your ability to, what we call cognition is the technical term that we use for it, so your ability to make decisions, to think things through, and people with brain injury, you might know, sometimes quite sort of impulsive and impetuous. They do things that they wouldn't normally do, that they don't have the same brakes on their behaviour as they might normally have, and swear a lot and don't behave in a very good way, that sort of thing,
Welcome to my world.
Thanks, Peter. And then the last part of the whare is the whanau. So, and we've heard from Tamati about the effects, the massive, massive effects that it has on the family, and the relationships within the family, not just at the time that the person's recovering, but also in terms of further on down the track, people are struggling in their relationships. People get divorced more easily in these situations. They get estranged from other members of the family because of behavioural problems or difficulties managing those sorts of day-to-day situations. So I think if you think about the effects of the brain injury in terms of the whare tapawha, I think that basically will cover all of the sorts of the main areas that we have to deal with when we see somebody after a brain injury. So last bit I'm just going to talk about is the rehabilitation of people with brain injury, and it's a very, very complicated area, but hugely important. And so when we have somebody referred to us with a traumatic brain injury, and we go into the hospital and see them, I'm thinking not only about the person lying in the bed who's suffered the injury, but also how that affects their whanau and how they, what the effects are going to be on them in terms of their education, their work, their friendships, lots of different things like that. So within our service, we have a process of trying to bring people through from the hospital in a way that it's what we call a no surprises method. So we talk about everybody is clear about what is going to happen. The person's going to come through to the rehabilitation centre. We're going to have a family meeting within a few days of them arriving there. We're going to do assessments. They're going to see all these different therapists. The members of the whanau are going to be welcomed and involved in that. So and we're also thinking about how long that person's likely to need with us as well. So that we don't set unrealistic expectations. Rehabilitation isn't something that happens just within a few days. It's not like being in hospital these days. I think the average length of stay in hospitals now is like 3 days or something. But the reality for rehabilitation is that it goes on for many months after a severe injury, years. So we try and think of all those things, and we try and welcome people to our rehabilitation services in a way that's meaningful to them. We try and set goals. Often a person with a head injury isn't really in a situation where they're able to do that, but sometimes they'll say, yes, I want to get back to doing things with the family, I want to get back to work, I want to drive the car again, those sorts of things. So they're able to generate those sorts of goals, but sometimes we have to talk to the members of the whanau and actually, find out what that person is like, because they're in a coma and they're not able to tell us about what they, what it is that they, what they would like to do. And when we have an idea of those goals, that helps us then to make the sort of program that will meet that person's needs the best. We're trying to generate things that are meaningful to that person. If we try and get them to do things that are not meaningful to that person, we're wasting everybody's time, the therapist's time, the patient's time. So that's how we work. We're gradually building, and over time, and like with you, Tamati, we're gradually building up the person's abilities. They wake up out of a coma. Sometimes in our service, we're working with their memory. We're working with their physical abilities, and with the physiotherapist at gym. We're working with how they, their speech, the psychological issues, all that sort of thing. So that's basically how we work. And then when we've completed our inpatient rehabilitation, we then have a transition process. We move people through onto a community program. Everybody pretty much goes through to a community-based program, and then that will continue on. And for us, the vast majority of people are going back to their own homes. We have like 95% return homes. Doesn't mean to say that the person's fully recovered, but they're getting back to their own home and familiar surroundings, and then they're still continuing on with the rehabilitation and and trying to get back to some sort of to what becomes a normal life for them. It can take a long time. It isn't the same as before, but it is for many people. They feel satisfied with their lives, and they're happy that they've moved on to recovery after their injury. Young men, as I'm sure you're aware, are overrepresented. Take more risks, drive cars faster, that sort of thing. Play contact sports. But we do also have a significant number now of kaumatua who are coming through. Falls at home is a major thing. So we're seeing a lot more people in the 70s and 80s who are coming through our service. In order to get very specialised rehabilitation, you need to go to a specialised service like ours, and there are very few centres in New Zealand. There's only 4 centres in New Zealand. And the problem is that members of the whanau have to travel very long distances to get there and to support their loved one. And it is a major issue. ACC is our funder, obviously, for people who've had a head injury, and they still do not recognise the stresses, the financial pressures, the stresses of being away from work, all those sorts of things, in order to provide that tautoko for the loved ones. So I think that if there was really one thing I want to change, and that would be that we had a much better system for whanau to be able to stay, pretty much on the site or near to the site for us. Yeah. That's a really good question. Now, so what we do know is that 80% of people who are in prisons have suffered a head injury. They've done 2 major studies in New Zealand on that. And so we know that it may be a factor in some people's behaviour and why they actually end up in prison. Yeah. So we have, now I've forgotten the name of this thing, it's social bonds is the new government contracts that they want to have people providing better services within the community for all sorts of things. But we have put in a bid for a social bond for providing support for people with head injuries in the prison system, because we think that they get forgotten about. And we think that if we do that, that they won't, when they come out of prison, that we hope that they won't get into trouble again, because the head injury is recognised.